Sometimes, despite knowing all the right things to do, we still don't do them. And perhaps if you forgot and lost momentarily the curve in your low back while you were under a load, perhaps just getting up out of a soft chair or bending over to pick up your shoes even, then you can have a nasty back spasm. And if you have a flexion intolerant discogenic pattern of back pain, especially if it includes something like sciatica or pain in the buttock or the leg, then that can certainly make your back pain worse. Now, even if you're doing all of the other exercises that are represented there at fixyourownback.com, sometimes this might occur. Don't beat yourself up too much about it. Let's just do a few things right quick from physical therapist Robin McKenzie's work that'll help you to get better very, very fast. Before we get started on those exercises, let's take just a minute to talk about some very serious things that you need to pay attention to. If you're having a kind of back pain that's associated with loss of bowel or bladder function, if you try to go to the bathroom and you feel like you're full but you just can't get anything out, or if you're having numbness or tingling around your groin or your rectum, or if you're having any kind of back pain that comes on in the middle of the night, sort of without warning, without activity. Your back pain's okay in the day and all of a sudden comes on while you're asleep at night. These are serious issues and you need to talk to your doctor about that. These exercises might help you temporarily, but if you're having those symptoms, get to see your doctor.
Let's start with this posture. If your back is really tending to want to spasm on you, you may find that this resting posture helps make the muscles calm down. Be careful getting into this rescue posture, making sure that you brace your belly muscles tightly as if someone is about to punch you in the gut. Keep the curve maintained in the low back as you're lying down and try not to twist your lower spine. You can rest in this position until the spasms calm and bide your time watching television, listening to music, or reading. Many find it helpful to place a small pillow or an ice pack or cold pack in the small of your back to preserve the curve while they are in this position. Choice of hot or cold is really up to you, depending on what you feel helps most. While both are effective pain modulators for those tight muscles, neither really penetrates deeply enough to affect any inflamed tissues close to your spine. When you're able, brace your abdominal muscles and get yourself into a prone position like this on the floor. Then press yourself up onto your elbows in the McKenzie prone props position as shown. Those familiar with yoga might know this as the Sphinx pose. Try to keep the pelvis down on the floor and keep the back muscles relaxed. Spend 30 to 60 seconds in this position before dropping back down into a flat prone position for 10 seconds or so. While you can do as many of these as you want without worrying about harming yourself, a common prescription is to perform 6 to 8 repetitions several times daily. Some may even find that doing these prone props every 20 to 30 minutes throughout the day when the back is really bothersome is needed. When able, you can try a more advanced version of the prone prop, known in McKenzie circles as the prone press-up, or it's known as the cobra pose in your yoga class. As in the elbow position before, you really want to try to keep the pelvis down on the floor and keep the back muscles relaxed. Some emerging research suggests that while this more advanced press-up might be fine for use for a week or so, if you're having an acute episode, long-term performance of this straight arm press-up might start to irritate other structures in the back. Another option is the standing McKenzie extensions. These can be done as a substitute to the floor version of the exercise if lying down on the floor is not an option. Try to use the hands to push the pelvis forward rather than using the low back muscles to bend backwards. That strategy will reduce the tendency of the tender back muscles to spasm. Whichever version of the McKenzie extensions you're using, it's common for the first few reps to cause a bit of pain in the low back. However, if your back pain is a flexion intolerant, disc-related type of back pain, then that early discomfort with the first few reps should give way to reduction in pain and relaxation of the spasming muscles.
In addition to those exercises that we just did, if you have a particular pattern of what's called antalgia, if you're bent forward and to the side and can't straighten your back up, sort of like is shown in this picture right here, you can try to see if you can do what's called a McKenzie side glide against the wall, like we show in this particular picture right here. Now, in this example, we're showing a person with a right lateral list on their antalgia. So if that's the case, if you're bent over towards the right, in order to correct that side leaning tendency, you want to put your right side against the wall and move your hip in like this, as is shown. So use these exercises to help to get you back into a higher level of function here in the next few days. And if you need something for pain, some over-the-counter anti-inflammatories or pain medication should be fine for you. Just use per label instructions there. Or you can consult with your doctor to get pain medication if you really feel like you need it. Once you feel like you're up to snuff again and you're able to move around a little bit better, that's the appropriate time to get back to some of the other stabilization exercises here at fixyourownback.com. And make sure that your movement patterns stay good and that you avoid loss of the lumbar curve while you're under a load or while you're sitting.